Hi, my name's Noel. I'm a psychotherapist. Welcome to my YouTube channel. I just wanted to give you some information today to go alongside my website on depression. The first thing to say about it is that it's very common and we can help a lot with depression. It can be sort of broken down really into sort of three areas: the sort of mild depression, moderate depression, and severe depression. On my website, I put a sort of quick self-help guide on the depression information page. With mild depression, there's a lot of things you can do for yourself. You don't really need to see anybody about it. It's probably worth always, though, checking in with your GP. I just want to stress that point. So go and check with your GP if you're not feeling very well, if you're feeling a bit low, or you've lost contact with friends, or things that you've done in the past don't feel as interesting to you, or maybe life feels a little bit hopeless. Do go and see your GP and do the test with them. So somebody who's mildly depressed usually will get over it with a few self-help tools. So with some exercise, phoning friends, talking to friends about the issues, particularly if it's in response to something that's happened. Maybe you've lost a job or something like that. There's no real need for any specialist input if it's just mild depression. But if it's moderate or severe depression, there's a couple of options for you. Traditionally, we've sort of referred people to their GP to get medication, antidepressant medication. Increasingly, though, we understand the benefits of talking therapy, either alongside or instead of sort of medication treatment. Talking therapy usually for depression is short term most of the time, so 6 to 12 sessions for sort of moderate type. And it's a particular form of talking therapy called cognitive behaviour therapy. That, alongside changes in your lifestyle, changes in your behaviour, will really help. So the sorts of things that you want to be looking at to avoid even mild depression most of the time, or certainly avoiding moderate depression and helping yourself in general, are things such as avoiding alcohol. Don't drink. Certainly don't drink above the recommended unit levels, which for guys are 21 units a week, and for women are 14 units a week. So certainly don't drink above that. And if you can drink nothing at all, you're probably better off. There's no real point in drinking, except every now and then to have a glass of something. Don't use street drugs. Some people will smoke marijuana to believe it improves their mood. Actually, the opposite of true. It's going to make your mood worse. And if it's repeatedly used along with alcohol to any degree, it will create mood problems for you. It may even give you a mood disorder when you didn't have one. So certainly don't use that. General health things are sort of fairly obvious, I think. Things like have plenty of fruit and vegetables in your diet, eat regularly, sleep regularly, have a good pattern to your sleep, and do exercise. Going out in the park, going for a walk, out in the fresh air really, really does help maintain the good mood. There can be physical symptoms that people go to see their GP about and not realising that these are actually signs of depression, so backaches and tummy aches and things like that. So if you're getting these types of things, don't ignore them. Do go along and seek help. Other types of things are if there's a sudden shift in your appetite, if you lose appetite, maybe you suddenly lose weight because you've stopped eating, or even a rapid gain in weight, any sort of big shift in a pattern like your eating, and also your sleeping. Maybe you suddenly become insomniac. Don't ignore that. It's very important to notice these things and go and talk to somebody about them. To try and figure out if you are depressed or not, you can use the depression score I put on my website on the depression page. But also you can think about things like, have you been in touch with your friends? Are you having problems with your family? Are there problems at work relating to people? So suddenly you're losing your temper and getting irritable with people. That can often be a sign. So as I say, there are two types of treatments that you can have. Generally now recommending for sort of moderate depression that you go for psychological therapy first, talking therapy first. Come and see a psychotherapist like myself and get cognitive behavioural therapy. If it's severe depression, you probably would go on medication relatively quickly and also go and see a talking therapist such as myself as well. Sometimes people get suicidal or self-harming feelings when depressed. Don't ignore them. They won't go away. You're not necessarily going to do anything, but it's useful to think about what you are going to do if you have those types of feelings. So a quick sort of toolkit here would be something like have maybe 5 numbers that you have with you in your phone or on your About You. 5 because, some of them may not be in when you need to phone. So when you get these suicidal thoughts, you may plan to do something, or just a general feeling of I want to die, I don't want to be alive. Don't ignore it. You could include your GP and the Samaritans in that list of 5, and then 3 other friends, and then make the call. Make the call, and the depressed and suicidal feelings should go away. I think that's about it from me in terms of general depression information. You can get hold of me if you want. My phone number is 07506 319 745. That's 07506 319 745. My website is noelmcdermott.net. That's noelmcdermott.net. Thanks for dropping by. Bye.